Good evening. I am Dr. Papa Rao, consultant physician from KIMS Hospitals, Hyderabad, Kondapur. After the Second World War in 1945, the world has realized that it needs a global way of approach to health and the needs of the society of the globe. So, the WHO was formed formally and it came to action on 7th April 1948, and the rules and regulations are formed from that time. So to commemorate this, from 1950, April 7th has been the World Health Day. In other words, it is the anniversary for the World Health Organization. So the aim of the World Health Day is to improve the awareness among the medical professionals, among the general public of the entire globe. You know, so this year's theme is Our Planet and Our Health. Our planet, that means the environment of the planet, is essentially very important for the human health, because just because of the improper environmental effects, almost 13 million people are dying on yearly basis. So leave alone how many millions are becoming sick out of the present environmental status. Similarly, environmental crisis, weather crisis, climate crisis can lead to health crisis. More number of cancers, more number of lung diseases, airway diseases, asthma, and more number of heart diseases has been happening on a yearly basis. Hence, this is a global approach to reduce the global warming, at the same time global improve the environment of our own house, our own village, our own town and city, our own state, our own country, and every country in the world, leading to improvement of environment on the planet. So the burden of pollution, as you know, the air is polluted, the water is polluted, and the soil is polluted. Because of that, many pollutions happen. So, for example, air pollution, 90% of human population are breathing polluted air. And leave alone Hyderabad, it must be 100% of human Hyderabadis will breathe polluted air. Because of the pollution, where from the pollution comes from fossil fuel, burning of fossil fuel utility, at the same time using coal, using wood, etc. All these causes increase in environmental pollutants like carbon dioxide, nitrous, various pollutants of the air, and then leads to long term airway diseases, at the same time cancers. Water pollution at the same time also causes waterborne diseases. So waterborne diseases, when water is polluted, it can lead to gastroenteritis, diarrhea, vomitings. It can lead to cholera, it can lead to typhoid, it also can lead to certain viral diseases like hepatitis A, hepatitis C, etc., jaundice. So it's very important that we should have clean water and soil. In the name of improving production, what we are doing, we are putting lot of pesticides, lot of chemicals, lot of insecticides in the soil instead of natural organic manure, and this is creating pollution of the soil. And from the same soil we get lot of vegetables and fruits. The same chemicals will go into the vegetables and fruits, causing food pollution. So plastics, the use of plastics has increased over decades in the planet. Whole planet uses plastics. The plastics are there everywhere, right in the deep sea, deepest of the deep ocean to tallest of the tallest mountains. You can see everywhere, and this is being transmitted into from the foods. It goes into the human body. It goes from the human body into various organs like liver, kidneys, brain, and causes the damage of these particular organs. So, hence leading to early degenerative changes and long-term degenerative process. So, this is the reason why we need to take up this particular theme for today's our planet and our health. So, increase in global pollution also leads to increase in global warming because of various greenhouse gases and increased use of kitchen utilities like refrigerators, like air conditioners, like a lot of gadgets that can emit gases which can have deleterious effects on the ozone layer and can have secondary effects on the human health. So, extreme weather events and degradation of the water, degradation of the soil, at times at places where uh, there are floods, at places where there is droughts. So, water deprivation happens where it is required, and water excess happens where it is not required. This is secondary to global warming. So, global warming further leads to a lot of effects, and also plastics can go into every part of the body, and the toxins that are released as such will lead to a lot of cancers, as we know. And with all these, we have been learning lessons. The lessons being, one has to have an approach, a systematic approach towards reducing the global warming as well as environmental pollution at governmental level, at international level, at state level, as well as at personal level. So, this is our commitment to the planet to live responsibly, not to increase any global pollution or pollution to the environment. So, COVID 19 has taught us many lessons. Lessons include that healthcare workers are ready to work at any given point of time, and they are highly deserving to get appreciation. All healthcare workers world over were ready to face the pandemic, and this also has shown us a lot of inequalities in terms of hospital hospital equipment or medical facilities, medical services are not the same for everybody. There is a lot of inequality in our society. So, we have learned that in a hard way to live that on daily basis how to improve our day to day to reduce the pollution, at the same time improve our living conditions, because this planet is forever, and our children and their children and their children are going to be there. Hence, this should not be contaminated. As a result of all this global warming and unpolluted environment, the world has become wonderful place for mosquitoes and other disease causing agents. Now, mosquito bites leading to mosquito borne diseases much more than ever. And we are seeing today this March has been the hottest March in India in the last 122 years. Remember that how warming is increasing. So, what we have to do ultimately at a personal level, it is our duty, whatever that is possible to do. What are all the possibilities? Number one, try to be as natural as possible. Number two, we have to be environmental friendly. That means whatever we do, we should improve our sense to improve the environment in terms of reducing the air pollution, in terms of improving the water contamination, in terms of reducing the soil contamination, as well as in terms secondary leading to food contamination. So we have to be as natural as possible. Try to wear more cottons than synthetics. Avoid plastics as much as possible. And try to use the natural ways of energy sources like solar energy, like electric vehicle energy, which are by using lesser and lesser of fossil fuels, lesser and lesser wood, and also coal, which can increase the global warming. And not only our surroundings should be clean, the whole city, the community, at the community level, one can take up measures to improve the awareness of the environmental health. Further, it is transmitted, it is translated into the form of better health. When the global health is better, the overall health would be definitely better. So one should aim at reducing the use of plastics, because plastics can have many toxins and it can lead to. So try to use your own cotton bag to carry whenever you go for shopping, and try to use lesser and lesser plastics. In wherever it is required, carry your own cotton bag. And also this environment leading to, actually, because of the very thick, unhealthy, condensed calories, as we have been eating for more fast foods, which are more and more refined foods. This refining process is taking off the real nature of goodness of any eatable. And because of this, there is a storm of obesity all over the world. So refined foods, refined beverages, and drinks like cola drinks and aerated drinks, which contains a lot of free sugars, and this is going to increase the dense calories of our consumption and leads to obesity. Obesity is in alarming proportions, which can lead to more and more heart diseases, lung diseases, obstructive sleep apneas, and it definitely reduces the whole lifespan, both quality and quantity of person. So to contamination of the water sources, like using wells, ponds as as cleaning the buffaloes and the cattle, etc., and washing clothes, etc., at a stagnant water, which is a source of drinking water, and this sources should not be polluted. And still, almost 30% of the world population don't have access for potable water. They still drink from small pits and wells, and more uncontaminated. Basically, we have to, at the farmer level to government level, one should understand that we should not contaminate anything in the process of increasing the production. So increased production has increased actually carbohydrate part of the foods and vegetables, and hence just the eating more and more carbohydrates is essentially reducing the essential vitamins, trace elements, minerals, etc. in the foods. and where we are going. And that is improper diet to the human body for the health. So one should also aim at, using the environment for our health and using environment properly so that our health is better. So just reimagine once that we are in a state of breathing clean air, drinking clean water, and uncontaminated and pure foods. Just reimagine that we are in a world, such a world that where there's no pollution and everybody is happy without any, polluted environments, without any mosquito-borne diseases, water-borne diseases, and without any air pollution. This is not only World Health Organization's motto. This is should be every government's motto, every state motto, every community, and every person personally should be responsible about their health and others' health so that our planet is important for our health. Wishing you all on the World Health Day, health and happiness. Thank you very much.